Hello everyone, this is Nancy Velasquez, licensed clinical social worker for St. Luke's Weight Management Program, and today's podcast is titled, How to Find the Best Therapist for You. Counseling therapy, is there a difference? What is counseling? According to the American Counseling Association, professional counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. Psychotherapy is a general term for treating mental health problems by talking with a psychiatrist, psychologist, or other mental health provider. A mental health provider must obtain a certain level of education. Psychiatrist, for example, who can prescribe medication, is an MD, a physician. Psychologist is typically a PhD, and other mental health professionals hold a master's or PhD in their discipline. They must be licensed in their state. They must continue to have education in their discipline. Many hold additional certifications, and each discipline also requires, for example, clinical hours and supervision. You want to ask yourself, and then call your insurance company, the coverage for counseling. You want to obtain the list of your providers, inquire as to the number of sessions. Do you have a copay? And what else can the insurance carrier provide to you regarding this therapist? You may want to ask also your family, your friends, your physicians if they know of a therapist. You want to interview the therapist. You want to inquire if they have a sliding scale fee. Do you have a preference? Do you prefer to work with a female or a male therapist? What is their modality? What philosophy, what training drives their practice? Give yourself a few sessions to determine if this relationship is one that will benefit you, and trust your instinct. You want to inquire with the therapist, what experience do you have with people in my situation? What treatment modality do you practice? Are you licensed? If so, in what state or states? Is the license in good standing? Are there any infractions? And do they have interns in their practice? You want to obtain information about their educational training. How do they view, or how are they trained to view a person's situation or problem, and how can that be resolved? And what's the principles organizing their practice? The following slides provide a few of the most common types of therapy in the community. Cognitive behavioral therapy, or CBT, is when the clinician practices and believes that behaviors and beliefs are responsible for the development of a client's presenting problem. The therapist helps the client identify, challenge, and adjust maladaptive beliefs and behaviors. And the therapist also may teach the client breathing and relaxation techniques. The dialectical behavioral therapy, or DBT, includes CBT in addition to mindfulness, interpersonal effectiveness, emotional regulation, and distress tolerance. The eye movement desensitizing and reprocessing EMDR is a treatment modality highly used to treat trauma. The therapist uses bilateral stimulation through eye movements, tapping, or audio stimuli. The client recalls a painful or troubling event. The therapist walks the client through a series of questions. The therapist helps to integrate these painful memories. Patient may experience a shift in meaning, clearing of painful memories. Family therapy. Family therapy consists of couples, families, or children. Usually the problem or situation is in the context of a family system, and there are many models within the family systems therapy. Feminist therapy focuses on the connection between sex, gender, sexuality, race, ethnicity, religion, age, and other that influence a person's experience in the world. Gestalt therapy, existential therapy, focuses on the present moment and what is perceived and felt. The therapist helps put clients in touch with their feelings and behaviors. The focus is on the process. The humanistic approaches, that is, people have natural inclination to strive towards self-fulfillment, self-actualize, and self-determination. Clinician may use open-ended responses, reflective listening, and tentative interpretations. Integrative therapy uses a number of different theories and interventions. Narrative therapy, the therapist examines the person's story. A person's problems is a consequence of getting stuck in a problem. Is it possible to reconstruct the story? Clinicians help to deconstruct the problem. Clinicians help separate from the story. Clinicians help the client separate from the story. Psychodynamic, insight-oriented therapy looks at how the unconscious influences a person's thinking and behavior. Therapist helps bring awareness and understanding of how unresolved conflicts from the past may influence the present. Patterns may be replicated. Psychoanalytic. This is a long-term intensive therapy focusing on the client's unconscious and unresolved conflicts from childhood. So in summary, counseling and therapy works because of the following. An individual is invested in change, the therapeutic relationship, trust is established between the therapist and the client. The therapist does not fix the problem, but provides support to help the patient who wants to heal. Thank you, and have a good day.